afternoon and welcome to another interesting edition of Mother's Delight on Miek Radio. My name is Ngozi Patience and I am super excited to have you with me here again today. This is Mother's Delight on Miek Radio, a program that is specifically designed to cater for all your maternal care needs, your maternal care information and enlightenment. It's a program that cares for pregnancy, childbirth, childcare, all your needs. We have them all solved here. And I am happy to welcome you into another interesting edition of the show. On today's edition of the show, we shall be looking at female infertility. Yes, I know we started the topic last week, but due to popular demands and questions, we couldn't exhaust it. So we're going to continue from where we stopped last week. Have you ever been, no, let me not ask, have you ever been barren? It sounds somehow, and in Nigeria we tend to do God forbid. So I'll ask, do you know the pain that bearing or trying to conceive women go through? Well, you can understand, or you can have a sneak into their world. You can understand how they feel if you sit back, relax, enjoy today's edition, because we're going to be giving you loads and loads and loads of information about fertility. Now, fertility is something we don't shy away from in Africa, especially in this part of Africa, where you are validated as a woman only when you have a child. We are looking at female fertility first. We are not saying infertility issues is peculiarly a woman thing, no. But in this part of the world, it has to be more of a woman thing, because most times they ask, when they see newly wedded couples, even after a year, yes, we are that about children. Even after a year, they ask the woman, what's happening? And then they ask the man, how far has madam changed? That kind of thing, as if it has to be madam. So all the issues that may lead to that question is what we are treating on today's edition of the show. Last week, we started looking at female infertility. In a very brief definition, infertility will be the inability of a woman to conceive after a year of unprotected sexual intercourse. Now, we looked at the causes of female infertility in the last show. We said it could be because of the fallopian tube, it could be hormonal imbalance, service issues, plenty information. If you missed that edition of the show, I'll advise you to visit our Facebook page on www.facebook.com/Miek Radio, and then scroll through Mother's Delights, so you don't get to miss any part of the useful information we gave out last week. On this week editions of the show, we shall be looking at symptoms of infertility in women. We shall be looking at tests out to confirm a status of infertility. And even if it is confirmed, there is good news. We have treatments for infertility. So you see, today's edition is jam-packed. You don't want to miss any bit of it. We'll take a very short break, and when we come back, I will have with me Nurse OLUKOYA, who will be doing justice to the topic from an expert view. Do stay with us. We will be back soon.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers wears and shoes, school bags, lunch bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such people are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.
Just like a diamond, you shine from far away.
Download our radio hub on Google Play Store and Apple Store. Miek Radio.
I like it.
Hello and welcome back to the show. We are treating female infertility today. We started last week. You talked about the causes, and today we shall be looking at signs, tests, and prevention. Since you've talked about the causes, let me take you straight to the discussion for today. So what are those signs? Now we know the causes of, or do you want to, for the sake of just
we recap.
a recap?
Okay.
Yes.
Okay. Last week we talked about female infertility, and we are specifically talking about the female one. So infertility is a year without getting pregnant. At least 2 to 3 times in a week of unprotected sexual intercourse, and that means the partner is not like in a far place. They are in the same location and they are trying to get pregnant and the baby is not coming. So that's what we term infertility. But that's infertility within the range of a woman within the range of 25 years to 35 years. 25 years to 35 years is categorized as 1 year trying to get pregnant without unprotected. A woman above 35 years, it's infertility when it becomes without unprotected sex for about 6 months. So you need immediate action for that kind of woman because of the age range of the woman. Yes.
Okay. So we know what infertility is. What are the causes?
Yeah, we spoke
briefly.
We spoke about some causes, the hormonal causes. We talked about the ovulation causes. We talked about the age factor. We talked about the tubal factor. Yes. And then we talked about some factors like some conditions like endometriosis, then fibroids and all sorts.
Okay, so what are those symptoms now? Symptoms of infertility.
Okay,
I think it's glaring.
Yes, okay. Glaring. From the definition, it's like you're trying to get pregnant. The thing is, your menstrual cycle should be regular. There's nothing like it's coming this month, it's not coming next month. You shouldn't allow that to happen. You should see a doctor. You don't need to approach, you don't need to get married before you start sorting that out. You should sort that out. Yes, you should sort that out already as a teenager or as a single lady. Please don't wait till a normal person, as a lady or as a teenager, there's milk leaking out from your breast. Please go see a doctor. They need to regulate the hormones. There's an hormone that is not balanced. Yes, so please you need to regulate that, or you need to go to the hospital. You need to visit the doctor so that the hormones will be regulated. So that's the major sign of infertility. The major sign is trying to get pregnant and not getting pregnant.
Exactly.
Yes.
That's, like I said, it's quite glaring.
Yeah.
Well, since we know the causes and we know the symptoms to look out, most people, I am sure, are interested in, okay, how can we solve this? That's like the progress, which way out. I'll not let you dive into that just right away. We will take a very short break, and when we come back, we will be looking at tests and preventive measures. You can follow our conversation on our Facebook page on www.facebook.com/MEC Radio. You can also follow on our YouTube at www.youtube.com/MEC Radio. You can drop your questions, you can drop your observations and your comments. We will treat them as soon as it enters. We'll take a very short break and we'll be back right now.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers' wears and shoes, school bags, lunch bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such parents know that good-looking children are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.
Just like a diamond, you shine from far away.
Music, entertainment, politics, education, sports, news, all at its peak. MEC Radio. Stay connected.
Download our radio hub on Google Play Store and Apple Store. MEC Radio.
I like it.
You're welcome back to the show. It's still Mother's Delight on MEC Radio. The show is proudly sponsored by Heavenly Kids and Teens Wear. Heavenly Kids and Teens Wear is situated at Captain Cook Building opposite First Bank, Alagbaka, Akure. You can reach out to our sponsors for all your kiddies wear, their school needs, your maternity care wears, and even up to the teenage age. We cater for 0 to 19 years. You can check them out on their Facebook page at www.com/heavenlykidswear. You can also reach out to them on their numbers. It will scroll past your screen soon. Now we are talking about infertility. We've looked at the causes, we've looked at the symptoms. Now everybody wants to know which way out. That's like, which way out? Okay, now I've been trying to conceive. Okay, now I know why. Probably it's because of hormonal imbalance. Okay, or because of irregular menstrual cycle and all. What can I do? What's the way out?
Okay, for every lady, I would say, every lady, I think probably because I'm health inclined, that's why. But I think my advice to every lady is, once you're menstruating, once you're like 20, please, every lady should have gone for an ultrasound scan, probably an abdominal or abdominopelvic scan, so you know everything in your pelvic, all the organs, you know how fine and everything is, how it is. So for me, ultrasound is very important.
But sorry to cut you short. Ultrasound. I used to think ultrasound is when you're pregnant and then you want to hear your baby's heartbeat and all.
Okay, for a woman that's pregnant, she'll do a pelvic scan. But for a normal lady, she can do an abdominopelvic scan, an abdominopelvic low. So the abdomen, the pelvics, everything together.
Okay.
So you don't need to be pregnant before you say you want to go for a scan. A scan should be done to check all the organs, the major organs. Especially the pelvic scan, it shows the pelvic area, the uterus, everything. It shows the state at which they are.
Okay.
Because like a woman with fibroid, it's shown early. Like some women, like some teenagers they already know that they have seedlings, fibroid seedlings.
Oh,
yes, really? Yes, because it grows. Grows early. You know, this fibroid, it grows like virtually every lady out there. Like in Africa, 80% of every lady, or let's say 70% of every lady out there has fibroid. Okay. It could be small, it could be insignificant. But fibroid grows in the uterus, it just grows like that.
Okay.
So it's very nice if you do an abdominal.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers wears and shoes, school bags, lounge bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such parents know that good-looking children are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.
Just like a diamond, you shine from far away.
Okay. Yeah, welcome back to the show. Before we went on that short break, I was asking, you talked about fibroid seedling as if it's one normal thing. Is fibroid a normal part of a woman?
It's not a normal part, it's just a growth that happens in women.
It might not be dangerous.
Yes, it depends on the location of the fibroid.
Okay.
So that's why I said a normal lady should just go for an abdominal pelvic ultrasound. It's very good. Then a woman definitely trying to get pregnant. What do you want to show the doctor if you do not done a scan before? Exactly. So the first thing you should do is an ultrasound. You have to be sure that your uterus is good, everything is in place.
So that's the
first test every lady trying to get pregnant should do. You should have a abdominal pelvic scan.
The abdominal pelvic scan, like you call, I won't call the way. The scan is important because it helps you know the state of
your uterus, because it's the uterus that the baby will grow in. So we have to know if it's fine, if there's nothing there, if it's in the right place, if you have to know all those. Okay,
aside this scan, is there other tests that
lots and lots of tests? Okay, as I said earlier about a lady or a woman having irregular menses. Once you're having irregular menses, the hormones are involved. So there's a test called hormonal profile, which checks all the hormones. There are levels these hormones should be. So there are range of levels. So it must meet up. So if it doesn't meet up, there are drugs to correct these hormones in your body. So once a lady who's trying to get pregnant, the doctor will definitely tell you to do an hormonal profile to check if the hormones are in place.
Do you know what I'm thinking right now? I'm thinking that conceiving, pregnancy, it's actually more than meets the eye. So a particular hormone must balance up with a particular hormone for it to happen. And then for some people it just happens like that.
Very, very easily happens.
Okay, so there's the hormonal profiling. Yes. Okay, what other tests is there?
So we have some hormones too that are major. We have like progesterone. But this hormone
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers wears and shoes, school bags, lunch bags, and lots more from the cities of Europe and America.
Mom, this place looks heavenly.
And such parents know that good-looking children are happy children.
This message is brought to you by Heavenly Kids and Teens Wears.
Just like a diamond, it shines from far away.
Entertainment, politics, education, sports, news, all at its peak. MEC Radio. Stay connected.
Download.
Okay, so we are still talking about tests.
Yes.
You've talked about the hormonal. Yes. So go ahead.
So I was talking about the one major one, progesterone.
Exactly.
Okay, one of the causes we said is the ovulation issue. So ovulation is very relating. Definitely pregnancy cannot occur. So this progesterone test, it's among the hormonal profile. The progesterone, it's majorly done on day 21 of a woman's menstrual cycle.
Okay.
So that progesterone, it helps to know if a woman is ovulating or not. So that test is very, very important.
So why does it have to be on day 21? What's particular about day 21?
Okay, day 21, that hormone is very visible on day 21.
Okay.
So it shows, so the test has to be taken day 21. If it's taken day 22, I bet you they might have a wrong reading. So it's better done at day 21.
When the reading is most likely to be correct.
Yes.
Okay.
So as I said earlier too about a woman or a girl who is not breastfeeding or who is not pregnant and there's breast milk coming out. Yes. So we have a test also called prolactin. Yes, prolactin. So this test has to be done too, because they have to check the level of the prolactin level. Yes, because it has to be normal. The prolactin level of a woman has to be normal. If it's not normal, so definitely there's something wrong, and there are drugs to correct this abnormality.
Now, let's assume it's not normal. Are there drugs to lift it up or bring it down?
Yes, there are drugs.
So depending on your abnormality,
yes, there's a choice of drug.
Corrected.
Yes, there's a choice of drug. Yeah, there are choices of drug that can be used for the correction of it.
Great.
Okay, so we talked about the tubal factor too as one of the causes of hormonal profile of infertility.
Infertility in
yes, in female. So for the tubal problem, we have a test called HSG. So it's to check the tubes, if the tubes are patent. So normally if a woman is trying to get pregnant, these are one of the this test is one of the series of tests the lady has to do to check if the tubes, because it's the tubes that carries the egg, and it's the egg that will meet the sperm and it will turn to the baby in utero. So we have to be sure if the tubes are patent. So the HSG test is to check the tuber patency.
Patency in this case is its most likelihood to conceive.
Yes. Yes.
More or less like to check the validity of the life or something.
Yeah, because HSG, there are so many things that can affect, especially the uterus. Like a lady who has had a miscarriage, or who has had let's say what we call it, that you're trying to abort a baby. Yes, abortion. So for a lady who has had several abortions, if we reflect on the HSG, there will be scarring of the uterus.
Oh
yes. So and this scarring might affect the tubes too. So that's why the HSG test is very important for a woman trying to get pregnant.
Wonderful.
The HSG, yes. This test is done within, it depends on the woman's cycle, but it's done within day 10 and day 12 of a woman's cycle. Starting from the day, the woman will count from the day of the menstruation, the day she starts menstruating, to day 10 or day 9, like that. So it's done within day 9 to day 12 of the woman's.
There's an extension to 12?
Yes, there's an extension to 12 because to get a good result, most doctors will say that a woman should have rest. Probably it depends on the days of the menstrual flow.
Okay.
Like some doctors will say preferably the woman should have had 5 days of rest after the menstrual flow. So if she's menstruating for 5 days, 5 days after she can come for the test.
Okay.
So at times for a woman menstruating for 6 days to 7 days, it might extend to the 12 of the menstrual cycle. Yes.
Okay.
But it's not done after the 12. Most doctors don't like to do it after the 12 because it might not show a perfect result.
I have a question from our Facebook.
Okay.
There is Ayomide Lucia asking, there's a belief that when a woman has severe menstrual cramp,
okay,
and uses too much of pain relief, that it could cause infertility. How true is this?
Okay, it's not true because too much of
menstrual cramps and pain relief drugs.
Pain relief drugs, it's not the infertility that it will have effect on.
Okay.
It will have effect on your liver. It's not the fertility that it will have effect on. It's the
it has nothing. Pain relief drugs has
nothing to do with infertility. Yes,
okay.
It will rather affect your liver than affect infertility or your fertility level. It's definitely, and for somebody who is having menstrual cramps, just make sure you use warm water. That's why we advise. Yes, we advise for a woman to have a hot water bottle. Yeah, there's this water bottle that is done.
Yes, hot water bottle. Yes, so you can just place it on your abdomen.
Yes, or you place your leg in a warm water. Yeah.
Okay, it's okay. So for Ayomide Lucia, don't worry, your fear has been, it's not been confirmed. You cannot become infertile. You cannot have infertility issues from using pain relief. Okay, for all our viewers, you can send in your comments and your questions too. We shall be dealing with them before the end of the show. So you've been talking about tests.
Yes.
Now we've known, okay, what if I carry out this test and then I am told this, I am given drugs? Is that the prevention?
Yes, there are drugs and there are surgical procedures to be done. Okay, for
okay, depending on
what and what.
Your
okay, like pelvic scan now, it depends on what they see. If they see a fibroid, which is big, so I tell people there are so many people living out there with fibroids. There are so many people who has even given birth with fibroid, who have even reached their menopausal stage.
This fibroid issue,
birth with, yes.
This fibroid issue, is it that it does not give out any signs or symptoms on its own?
Okay, for
like if you're not trying to conceive, for example.
Okay, the thing is, for severe fibroids, for some fibroids that are big, it gives out issues. Some women start menstruating heavily, bleeding heavily. Their messes become so heavy that it keeps pouring, and they don't have a choice than to go through the surgical procedure by removing it.
Okay.
Then I tell women, there are so many women living out there. So many women give birth with fibroid. Lot of women. I know people that have given birth to all their babies, even 5 children, and they have fibroid. Yes, with the fibroid. So it depends on the location of the fibroid. It depends on the size of the fibroid.
Okay.
So it depends. Then I tell people, please listen to your doctor. Once your doctor says this fibroid has to be taken out, please listen, because I've had so many cases that once a woman removes her fibroid, it's like she becomes so fertile, like, because some fibroid would not allow pregnancy to occur. Yes. I've had cases, I've had so many patients that once they remove fibroid, in the space of 6 months, they are pregnant.
Wow.
I've had patients like in the space of 2 months, 2 years, she has had 2 babies.
Wow.
With fibroid, after she removed her fibroid. So fibroid removal, it can be very good.
And then you cannot get to know to remove a fibroid if you don't carry out this test.
If you don't do an ultrasound, that's not how you will know you have a fibroid.
Now,
so please listen to your doctor. Once your doctor says you have to remove this fibroid. Some people say they don't want to remove. I've had cases of people that they will go to the mountain top, they will go to this one, they don't want to remove the fibroid. Please and please listen to your doctors. Once they say, definitely you keep praying, but once your doctor advises you on what to do, please kindly take to the advice. It's very nice.
The advice of your doctor. So any last words for us before we sign out on today's show and on female infertility?
Okay, we have some treatments.
Okay.
Yeah, so the treatments, like I said about when I was talking about the tests, their treatment, their choice of drug for all these signs and symptoms. Their choice of drug for the fibroid, you can do a surgical removal. Their test, there are some procedures that can be done to view your uterus, to do some tests. The endometriosis, that's the infection of the uterus. There are tests that there's a particular test that can show lot and that can remove all what you want to remove. So there are tests to it. Then we have treatments. We have some fertility drugs too that can be advised to be used by your doctor. Really, I don't really want to mention some, but most women, they use Clomid. So please, I want to say this on here, so that please, because you're trying to get pregnant does not mean you should use Clomid. You need Clomid is a choice of drug used to boost ovulation.
Okay.
Yes, but the thing is, it's not every woman that must use Clomid. It's not necessary for you to use Clomid until your doctor says you should use Clomid. So many people, when they're trying to get pregnant now, straight.
I saw some
my friend
online where the issues of folic acid, vitamin E.
Okay, yes, those are routine drugs. Those are routine drugs that must be used. Like for a woman trying to
those ones must be used.
Yes, must be
now
used.
Get the difference.
Yes.
Your routine drugs, folic acid, vitamin E must be used.
Those are routine drugs that must be used.
She said
Clomid is not a routine drug that should be used. Because your friend used Clomid or the doctor told your friend to use Clomid does not mean because you are now trying to get pregnant you must use Clomid. Please, Clomid is not a choice. I've had people that use Clomid and had issues that give them serious issues. So please don't start using Clomid anywhere. It's not always a choice of drug for everybody. Then also we have some tests now, like we have some treatments. Like then I also advise that age. I said age factor can be a major factor in causing infertility. Yes, so please try and get married early. Now the world has even changed. So many people getting married 22, 23. So please try and get married early because it helps. Because those hormones at that time they are very active and vibrant. So it's best when you try to get pregnant at that time, not waiting till the late 35, not waiting till the late 40s. It's very nice when you get somebody. Don't rush into marriage. I'm not saying you should rush into marriage. I'm not saying you should rush into marriage, but I'm saying that when you get the right person, you don't need to wait for age 35. You don't need to wait for age 30. You don't need to wait for age 40 before you get married. Once you have the right person and you know you are ready. You're really ready. You must be psychologically ready. Yes, you must be psychologically ready. It's not for children. Marriage is not for children, so that you not go and run back to your parents' house.
So I at 22.
Yes, we have some people that are ready at 22.
No, when you have to quote and why are you doing that?
No, I'm not saying you should. No, I'm not saying because you are 22. Please finish your education. You have to be financially ready. You don't have your husband. I said before you buy matches, you have to wait for your husband. You have to be financially ready. Exactly. So all this comes in place. So I'm just talking about the age factor because the age factor is it's very important because at the young age those hormones are very vibrant and active and it helps in pregnancy. So don't wait till some women can be very nonchalant. They are regular, they have everything it takes, but they are saying I beg. Yes, you can see where there's time. I beg. They don't take late comers. Yes, they don't pick late comers for it. But please and please, for the sake of fertility issue, please and please,
the
earlier the better because of those hormones. Then there are also some treatments like IVF, as we all know. So many people talk about IVF. There's also another one, the IUI, intrauterine insemination. It depends. It's the doctor that advises because it depends on the results. So it depends. This mostly is done for probably the man that does not have a good sperm count. Okay. So they'll tell the woman, they will tell the family to go for an IUI, whereby they have to wash the sperm and they have to use the good sperm and just put the good sperm for the woman instead of the sexual intercourse. This they just use.
So it's just injected.
Yes, they just inject it into the uterus of the woman. Straight, you inject it into the cervix of a woman. The good sperm, that's the procedure that they will use to wash the sperm, and it's the healthy sperm that goes into the woman. And for the IVF, we know that the egg has to be taken out. It has to be taken out. Then the sperm too out, and both are put in the lab and both joined together and then implanted into the woman later. So we have so many treatments like that, and we have so many choice of drug. So the thing is, it's not all about that infertility that it's all about drugs. There are so many people that have taken these drugs. There are so many people that have IVF has failed. Also, please, let's put God's factor. There's always a God factor. So if you're trying all this, try and pray, because we have so many people that have had perfect results,
and their miracles.
No, they're perfect results. There are people that have had perfect results and still they can't conceive. Very perfect. The hormonal profiles are perfect.
Okay.
The uterus is perfect. Everything is perfect, and still they are trying to conceive. So there's always a God factor. Please make sure you put the God factor.
Thank you very much, ma'am.
Yeah.
I am sure you have learned a whole lot about female infertility, and like we keep saying, prevention is better than cure. So as a young lady, as a single lady out there are those signs you should look out for, and once you see them, you should know you should contact your health providers.
Yes.
And if for any reason you overlook these signs and you're already trying to conceive, there's still hope for you.
Please let me add. Please don't forget to treat any infection. As I said earlier last show about pregnancy, infection in pregnancy. There's also infection in a woman or a man. It's not necessary you are pregnant. Please make sure you treat all infection, because some infections later causes infertility. So let me add this. Please, as a man, as a woman, if you're having any infection, visit the hospital. Let the infection be treated so that it won't result to infertility.
That will be one of the preventive measures.
Yes.
It's all right. We've had a very interesting and exciting edition.
Yeah.
Keep touch with us, same station next week as we bring another interesting topic your way. Until then, enjoy the rest of the day.
Parents who know how to care for their kids begin to care right from when they are in the womb to the time of birth and throughout their teenage years. Such caring parents are passionate about what their kids and teenagers wear and how to make them look good at festive periods and always. Such lovely families are regularly found at Heavenly Kids and Teens Wears, shopping for their prenatal and postnatal needs, teenagers' wears and shoes, school bags, lunch bags, and